So the ZiPUP study is it's a new PET scan in urothelial cancer. Because we know that CT is pretty average for staging, we use a lot of FDG PET to stage urothelial cancer, but we wanted to see if this new imaging agent, which is zirconium girentuximab, would be a more useful imaging modality for urothelial cancer. So the girentuximab is a carbonic anhydrase 9 ligand. And that's expressed in lots of tumors, and it's been popularized in renal cell carcinoma with the ZIRCON study, where it's been shown to be quite useful in identifying renal tumors. So we're interested to see it be useful in urothelial cancer. One of the main problems with FDG PET is that all of the excretion of glucose in the urine means that the urinary tract always looks very, very hot, whereas the zirconium girentuximab is metabolized in the liver. So we hoped it would be better for staging urothelial cancer and maybe picking some of the upper tract lesions and bladder lesions themselves a bit better. So this was a first in human use in urothelial cancer. So we recruited 20 patients. Most of the patients were having staging prior to surgery, and this meant we also either cystectomy or nephroureterectomy with a lymph node dissection. So we had the potential to compare positive lymph nodes on the PET scan and the FDG PET scan, with truth being histology. So in most of the patients, so we had two groups of patients, either the surgical ones who were having lymph node dissections as well. So that was really just a staging investigation in addition to their FDG PET prior to their surgery. And then we had some patients with metastatic disease as well, where we compared the two scans. And really, we were mainly looking to see safety and feasibility. But we also wanted to get sensitivity and specificity for looking at the uptake in lymph nodes and also identification of other metastatic sites, which one was better. Yeah, so as I said, we recruited 20 patient study, 13 were surgical patients and 7 were metastatic patients. And the majority of patients had bladder cancer, but there were some patients with upper tract TCC as well. And the main findings were that it was certainly safe and feasible. We did have some adverse events, as with any clinical trial, but none seemed to be in any way related to the administration of the zirconium girentuximab, which we called ZiPUP for the purposes of the study. Certainly the FDG PET and the ZiPUP PET were congruent in most cases, so they showed uptake similarly in 17 out of the 20 cases. The metastatic sites were actually better identified with the FDG PET as opposed to the zirconium PET. And there was actually a higher SUV max, which is the tumor to mediastinum ratio. So you see how much uptake you get in the tumor, and you see how much uptake there is in the mediastinum, and it basically shows how hot it is on the nuclear medicine scan. But that was actually much higher on the FDG PET than the zirconium PET. In the patients with surgical lymph node dissections, we actually had slightly better concordance with pathology with the zirconium PET, but it was quite a small number of actual positive lymph nodes, so it wasn't able to draw any statistical conclusions from that. In terms of detecting upper tract TCC and disease in the bladder, they were exactly the same at finding the bladder primaries, but we actually found that the FDG PET picked up more upper tract TCC than the zirconium. So in conclusion, we've shown that it's safe and feasible, but it does see that FDG is better at identifying metastatic sites than zirconium, despite the lack of urinary excretion. However, carbonic anhydrase 9 is a useful target. It's expressed in lots of tumors, and there, of course, with antibody-related PET, there's the opportunity for theranostics, where you can actually incorporate a lutetium as opposed to zirconium, which is a beta-emitting molecule that can actually be used therapeutically. So it may be that if there is a patient with congruent FDG and ZiPUP PET, then you might be able to consider that use as a theranostic. But there are actually other carbonic anhydrase 9 ligands which are coming around, some peptides, and maybe in the future some mini-bodies, so sort of between peptides and antibodies. So we hope that there would still be a useful target, but there are probably some other targets as well we could look at for urothelial cancer.